Sitting up in bed. As ever, all transfers and use of equipment are underpinned by a thorough individual risk assessment. Here, the head end of the bed is raised electrically by the hand push-button control. To prevent the person sliding down the bed, insert a slide sheet between the person's back and the profile section of the bed, and remove the slide sheet once the head end has been raised. There are a variety of bed ladders, ropes, or pulls available. The handler attaches the bed ladder to the foot of the bed. The person grasps the ladder. The person pulls themselves up into a seated position using their arms, flexing forward at the trunk and hips. It can be difficult for the person to let go of the ladder and maintain sitting without the hands being placed on the mattress behind the trunk. Therefore, the person may need to keep hold of the bed ladder. If the person needs a little more assistance, one handler can apply a gentle push contacting the person's nearest shoulder blade. Or, if further assistance is needed, two handlers can gently push to assist the person to sit up in bed. Another form of a bed ladder with Alan keeping his arm and abdominal muscles strong with its use. He'll have a six-pack before the end of the month. I think I'll order one. Move over, Peter Andre. Another handling aid that can be used with or without the person using a bed ladder is this patient handling sling. If the person has skin viability issues or musculoskeletal disorders in the neck and/or upper extremities, the use of a patient handling sling or a similar handling strap is indicated. Using the Prism multi-glove, Jeff slides the patient handling sling under Alan's upper back so that both outer handles of the handling sling are visible to the handlers. The head end of the profiling bed is raised. If there is no profiling bed, the person should use a bed ladder at the same time if this is deemed appropriate after the individual's risk assessment. Both handlers stand level with the person's waist with their nearest knee on the bed, being mindful of the bed's safe working load. Here, Gareth on the left grasps the handling sling's handle nearest to him with his right hand, and Jeff on the right grasps the handling sling's handle nearest to him with his left hand. A team leader is nominated who verbally guides the person to sit up on the command of sit in ready, steady, sit. The team leader gives the command of ready, steady, sit, and both handlers gently assist the person to sit by sitting back onto their heel on the bed. Both handlers support the person in the sitting up position. The handling sling can also be used to assist the person to lay down from a sitting up position. If no bed ladder or handling sling is available and it has been deemed safe for the person and handlers following risk assessment, two handlers can assist the person to sit up, coupling with the person's arms. The head end of the profile bed is raised. Both handlers stand level with the person's waist with their nearest knee on the bed, being mindful of the bed's safe working load. Here on the left, Gareth with his right hand gently couples with Alan's right elbow, inner aspect. Alan couples with Gareth's right elbow, inner aspect. Here on the right, Jeff with his left hand gently couples with Alan's left elbow, inner aspect. Alan couples with Jeff's left elbow, inner aspect. A team leader is nominated who verbally guides the person to sit up on the command of sit in ready, steady, sit. The team leader gives the command of ready, steady, sit, and both handlers gently assist the person to sit by sitting back onto their heel on the bed. Both handlers support the person in the sitting up position. This coupling can also be used to assist the person to lay down from a sitting up position. Okay, it's ruin your back time. If you want a life-changing herniated lumbar disc, do this. If you suffer a disc injury, it won't be slow to go. In fact, it never will go. Get ready for multiple visits to the GP, orthopedic consultant, pain management clinics, pharmacy, and possibly you will meet the surgeon's knife. Gripping the person can bruise soft tissue if consideration is not given to skin integrity. And here another variation of the drag lift. There is high risk of musculoskeletal injury to the handler's necks, shoulders, and lower backs, and for the person, high risk of musculoskeletal injury to the shoulders, to the skin, and to the nerves, and blood vessels in the armpit and upper arm. Another hazardous coupling method, gripping the person's arms. Oh, what was that? Oh, the person's shoulders have been pulled out of their sockets. We can pop them back in, can't we? Can't we?